Psychotropic drugs. We are Group 12 members Izot, Dailini, Bhavithra, and Angie.
Definition of psychotropic drugs. Drug prescribed to stabilize or improve mood, mental status or behavior. They are compound that affect the functioning of the mind through pharmacological action on the central nervous system. It work by changing or balancing the amount of important chemicals in the brain called neurotransmitter.
Examples of psychotropic drugs. Example of psychotropic drugs consist of typical antipsychotics such as chlorpromazine, thorazine, flufenazine, prolixin, haloperidol, Haldol, profenazine, drilifan, thioridazine, Mellaril. Atypical antipsychotics aripiprazole, Arion, clozapine, Clozaril, and iloperidone, Fanapt.
Next, the example of anti-anxiety agents are alprazolam, Xanax, clonazepam, Klonopin, diazepam, Valium, and lorazepam, Ativan. While for stimulants are amphetamine, Adderall, Adderall XR, dexmethylphenidate, Focalin XR, dextroamphetamine, Dexedrine, lisdexamphetamine, Vyvanse, and methylphenidate, Ritalin, Metadate ER, Methylin, Concerta. There is also selective serotonin reuptake inhibitor antidepressants which consist of citalopram, Cipram, escitalopram, Lexapro, fluvoxamine, Movix, paroxetine, Paxil, and sertraline, Zoloft. While for serotonin norepinephrine reuptake inhibitor antidepressants are atomoxetine, Strattera, duloxetine, Cymbalta, venlafaxine, Effexor XR and desvenlafaxine Pristiq.
The example of monoamine oxidase inhibitor antidepressant are isocarboxazid, Marplan, phenelzine, Nardil, tranylcypromine, Parnate and selegiline Emsam, Adipril, Carbex, Eldipril, Zelapar. Tricyclic antidepressants consist of amitriptyline, amoxapine, dizipramine norpramine, imipramine tofranil, nortriptyline pamelor and protriptyline Vivectil.
The last one is mood stabilizer, which are carbamazepine carbatrol, Tegretol, Tegretol XR, the Valproex sodium, Depakote, Lamotrigine, Lamictal and lithium, Escalate, Escalate CR, Lithabit.
Recording of psychotropic drugs.
There will be date of sale or supply, serial number of prescription, name of patient, address of patient, poisons or medicines supplied and quantity supplied in the prescription book.
Prescription register for psychotropic drugs. Anyone who sells, supplies, or administers psychotropic drugs for medical or dental treatment is required to keep and maintain a registry called the Prescription Register for Psychotropic Drugs and shall enter or trigger to be entered therein true particulars of the following on the day such psychotropic drugs were sold, supplied, or administered, which are the date on which the psychotropic drugs were sold, supplied, or administered, as well as the entry's serial number. The psychotropic drug's name and strength, as well as the quantity sold, supplied, or administered and the patient's name, identity card number, passport number, or some other form of legal identification, as well as his or her address. Labeling of psychotropic drugs. Where psychotropic substances are sold or supplied for the medical or dental treatment of a particular patient, the container of such psychotropic drugs must be clearly labeled with the following information, which are the seller's or supplier's full name and address, the patient's or purchaser's full name, adequate instructions for the use of such psychotropic drugs, the day that such psychotropic substances were sold or supplied, and the psychotropic drug's name and strength.
This is the example of psychotropic drugs label.
Control on the sale and supply of drugs. Registered medical practitioners, dentist, veterinary surgeon, a licensed pharmacist upon a prescription prescribed by medical practitioner, dentist and veterinary surgeon, and registered pharmacists who are employed or engaged in dispensing medicines at a public hospital or other public institution are allowed to handle psychotropic drugs.
Storage of psychotropic drugs. Must store the substances in a room, cabinet, safe or receptacle which shall remain locked and can only be reopened to carry out manufacturing, dispensing, mixing, sale, supply, Education and research. Keep other psychotropic substance and conduct stock check. Any room, cabinet, safe or receptacle used to store any psychotropic substance shall only be locked and unlocked by the person authorized to process such psychotropic substance, and the keys to such room, cabinet, safe or receptacle shall be kept by registered pharmacist only. For the purpose of this regulation, any room, cabinet, safe or receptacle used for storing any psychotropic substance shall be so constructed and with reasonably sufficient security measures in order to prevent theft or diversion of the psychotropic substance stored therein. Information needed during dispensing. Outpatient. Name and address of the supplier or seller. Name of the patient or purchaser and the name of the medicine. Adequate directions for the use of such medicine. Date of delivery of such medicine. Where such medicine is sold or supplied and entered in a prescription book, with a reference to the serial number of the entry in such book relating to such sale or supply. Shall be labeled on the container the words controlled medicine. If it is for external use, the container of such poison or medicine shall be labeled conspicuously and distinctly with the words not to be taken or for external use only printed in red or on a red background.
Information needed during dispensing inpatient. Name and address of the hospital, infirmary, dispensary or institution from which it was supplied. The name of the medicine. The words controlled medicine. Report book or form for psychotropic drugs. Dangerous drugs and psychotropics logbook. The date, reference, ward, quantity of drug supplied, drug balance, and the recorder's signature must all be filled out in this logbook. Indent form. This form is used to request dangerous drugs and psychotropic drugs, and it must include both the quantity requested and the quantity supplied. Dispatch book. A list of drugs available in each ward is included. This book keeps track of the quantity of dangerous drugs received from the pharmacy and the quantity of dangerous drugs administered to the patient.
Dispensing workflow. First, the staff nurse need to fill the indent form to request for dangerous drug and the quantity needed for pharmacy. 2 sheets of indent form are required to be sent with the dispatch book. In the dispatch book, the quantity of dangerous drugs received from the pharmacy and dangerous drugs administered to patients are recorded. To guarantee that the balance of dangerous drugs is in stock, the pharmacist must check the indent form and dispatch book. The red pen is used to identify and correct errors, while the blue or black pen is used to cancel or cross out any mistakes. To ensure that the order and record the balance of dangerous drug after each supply, the pharmacist must verify the indent form and note the reference number and the amount of drug delivered in the logbook.
7. The pharmacist should refer the patient to the correct ward or unit. 8. The staff should explain the reason for the drug shortage, as well as the amount involved, afterwards. 9. The supply of dangerous drugs should be recorded in a register book, which should include the quantity of dangerous drugs and be signed by the pharmacist. 10. Only then can the dangerous drug be administered by the ward staff. 11. The pharmacist holds the original copy of the indent form, while the nurse gets the carbon copy. 12. The nurse must double-check the supply quantity and sign the both record book and the indent form.